Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. First of all, let us thanks to Allah Subhanahu wa Ta'ala. Because of Allah's blessing, we are able to be here in this presentation. Secondly, salawat and salam also delivered to our Prophet Nabi Muhammad Sallallahu Alaihi Wasallam, who has guided us from the darkness into the brightness. Ladies and gentlemen, the presentation today is about postpartum care. Now, I will read one by one the agenda today. There are 4 sessions. The first session is opening. The second session is introduction. The third session is presentation. And the fourth session is closing. Well, ladies and gentlemen, before I show my presentation, let me introduce myself. My name is Hafsa Kinwafa. And now, let's open our meeting by saying Basmalah together. Bismillahirrahmanirrahim. Thank you. The next agenda is presentation. The topic we will discuss today is about postpartum care. The first point we're going to discuss is definition of postpartum care. Postpartum is the time it takes to restore their reproductive organs to the way they were before pregnancy. Let's move to the next slide. Why? The postpartum care is important because it can prevent hemorrhage, provide physical comfort, nutrition, hydration, safety and elimination, provide health education about self-health care, nutrition, family planning, methods, and benefit of breastfeeding and immunization and daily baby care. Let's now move to the next slide. How many visit in doing postpartum care? The frequency, the postpartum visit is 3 times. The first visit is carried out 6 hours to 3 days after delivery. The second visit is 4 until 8 days after delivery. The third visit is 29 until 42 days after delivery. We have to check blood pressure, vaginal bleeding, perineal condition, sign of infection, uterine contraction, fundal height, and temperature regularly. Let's now move to the next slide. Who is going to handle the postpartum care? The postpartum care is handled by OB/GYN or midwife. Let's now move to the next slide. What are the treatment for doing postpartum care? As you can see here, the treatment, there are 2 types. There are normal postpartum care and care after cesarean delivery. The normal postpartum care, treatment for vaginal pain, for bleeding, for contraction, treatment for urinary disorders, care for breaths, care for hair and skin, and stabilize emotion. And care after cesarean delivery, prevent of blood clots, treatment for postpartum cramps, prevention of infection in the surgical wound, risks in the first week postpartum mental state. Ladies and gentlemen, finally, we are come to the last agenda. I would like to say thanks for all of the audience. Now I will conclude the presentation today. Postpartum care is the time it takes to restore their reproductive organs to the way they were before pregnancy. That's why the postpartum care is important. We should visit postpartum care 3 times to the OB/GYN or midwife. Hopefully, the presentation will give benefits for us. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh. See you later.